More than 400,000 people have died from complications related to COVID-19. Even though this is an alarming number, the fatalities could be significantly higher if none of the population had followed the CDC guidelines that recommend keeping 6-foot social distance, wearing a mask while in public, and isolation in case of experiencing symptoms or testing positive for the virus. Unfortunately, not everybody is able to follow the advice of these experts due to their living conditions. This is the case of more than 2 million people that became one of the most vulnerable populations, prisoners. According to a New York Times database, more than 500,000 people in jails and prisons have been infected with the virus, and at least 2,200 inmates and correctional officers have died of coronavirus-related causes. Jails and prisons are ideal environments for infectious disease to spread. Prisoners live extremely close to one another in poorly ventilated areas. They share showers, toilets, and are often denied cleaning supplies, masks, soaps, and hand sanitizer. Inmates also have contact with employees that may be infected. This population is vulnerable to complications related to the virus due to the likelihood of having underlying conditions. Health experts have advised the government that incarcerated people should receive the vaccine against the virus during the second phase of its distribution, the first phase including frontline health workers, and third, the general population. Even though this is a public health matter, it has become a moral and a political issue. Many people have criticized the decision, claiming that prisoners like Nathan Dunlap, who serves a life sentence at the Colorado State Penitentiary for the slayings at a Chuck E. Cheese restaurant in 1993, should not receive the vaccine before those that have not committed a crime. However, others disagree. Activists around the country have raised their voices, asking the government to prioritize this population due to the high risk of contamination that they are exposed to. So the question remains, should the government make its decision based on public safety or make it a moral dilemma? Regardless of the population's opinion, the decision falls in the government hands. Reporting for GSU TV, this is Grace Quijano Stone.